And this morning we are looking at, firstly, immunologic emergencies. When we hear the word immunologic, we are talking about the immune system and we are talking about emergencies. So it's going to be issues that involve the problems with the immune systems, and you're called to these cases. Now, these cases can range from mild allergic reaction to severe allergic reactions, and you can have various issues with the immune system. But for our intent and purposes in the pre-hospital settings, we are going to be focusing mainly on the anaphylaxis, severe allergic reactions. But it is said that at least 1,500 Americans die annually of acute allergic reactions. And these allergic reactions are related to emergencies, can involve acute airway obstruction, cardiovascular collapse. And that's where you'll be called most of the time when it has reached to that proportion or is reaching to that proportion. Distinguish between the body's usual response to an allergen and an allergic reaction. So our job is not to find exactly what is causing the reaction. If possible, yes, but it's really to treat what we are presented with, and ultimately it can reach to that point where the airway is completely obstructed and the person going to shock and you have total collapse of the cardiovascular system. So it's just to ensure that you are treating what is presented and recognize that these emergencies or issues can have serious implications and they can happen fast. So with every emergency you are dealing with, you have to look at the body system that is affected so you can better appreciate what's happening. And when we're looking at immunologic emergencies, we know that it's going to be the immune system that is impacted. And the purpose or the function of the immune system is to protect the human body from foreign substances and organisms. So this is a system that polices the body and defends it against all foreign invaders. And it does this protection in two ways. So it's either going to be cellular immunity, in which case the cells are generated to go and fight the invaders, or it can be humoral immunity, where you have antibodies are being produced by these specialized white blood cells, which give rise to that protection. So we need to recognize that there are 5 general categories of allergen. Allergen is a substance that is likely to cause an allergic reaction. And these are the 5 categories that they will come from. You can have allergy coming from, allergen can be in the form of an insect bite or sting. You have certain medication that can be an allergen, certain plants, foods, chemicals. The main medication we look at would cause allergy, would act as an allergen, would be antibodies, antibiotics, penicillin. You have the non-steroidal inflammatory drugs. From the plant group, you have oak, ragweed. From the food groups, you have shellfish, you have peanuts, and different chemicals will be act as allergen, which cause an allergic reaction. So you need to recognize that these are the 5 general categories where you have allergens coming from, and the persons can be allergic to them. Normally, they will not cause an allergic reaction in the general population, but you have certain persons will have this allergic reaction to these substances from these groups. And so that is where we'll have this hypersensitivity developing, and they can have these severe emergency cases. So we recognize the immune system is what is impacted when we have immunologic emergencies, and we look at the anatomy, and you will recognize that you have the white blood cells, which would be the soldiers to mount this defense. And how it works is you're going to have a first response where the person is being sensitized. So the sensitization phase is there. The allergen enters the body recognizes it as being potentially likely to cause an allergic reaction, and it's gonna copy it and send it to what we call the B cells, and they will develop antibodies, IgE, which are immunoglobulin E, which are antibodies that will be sent to the mast cells and the basophils, and they are stored there. So that's the initial response phase, the sensitization phase, which normally is mild, but these cells now are ready and armed. In case that same allergen enters the body, it will recognize it, and then it will generate the second phase, which is the activation phase, where these basophils and mast cells have what we call chemical mediators, and they will be released once they recognize that the allergen is there, and it will release the chemical mediators, which will be in the form mainly histamine and leukotrienes, that which will have these reaction on other organs, and that's where you're gonna have the second phase of the response, which is the activation phase, where you have the real signs and symptoms coming out, and that is what the person will present with. So this is what will happen. You have the mast cell or the basophils, which would have been armed with the antibodies, the IgE, from the initial exposure where they become sensitized. And once the allergen returns and the second exposure, then they picked up these antigens and recognize that they are possible likely to cause an allergic reaction. And this will in turn cause the release of the chemical mediators, and these will cause action on certain end organs, and that's what will have been shown in the signs and symptoms. So the histamines and the leukotrienes that are released, histamine initially, followed by the leukotrienes secondarily, will cause the lungs to it causes bronchoconstriction, and it will cause act upon the heart to decrease the contractility of the heart, and also the coronary flow. The blood vessels will cause them to vasodilate, and they will become more permeable. So it's gonna cause fluid to leak out, and once they are dilated, then it will cause a drop in the blood pressure. The skin will be affected in that you will have the nerves being what you call depolarized. So they will have itching, which is pruritus. You will have because of the edema, fluid leaked out into the extravascular space. Then you're gonna have rash, hives, urticaria, and generalized. It will start with local edema, and if this condition continues, this hypersensitivity progress, then this immune response will progress and can become systemic, which will give rise to the severe allergic reaction, which will what we know as anaphylaxis. So ensure that you understand what is happening there. Now, this immunity can either be acquired or it can be natural. So natural immunity is what we call innate immunity, meaning that you're born with it. So innate, born. So you have this natural immunity from birth, but also you can develop immunity. So it's acquired, or you can get it from vaccine. So after being sensitized, persons who contract the virus, they would get immunity from that, and that's where we have acquired immunity. But the best one we have is your natural immunity, which is from birth. You have that inborn immunity. So when we look at the pathophysiology, so the normal system is that our immune system will mount a defense against foreign invaders, which will be harmful or can be harmful to the body. That's how it is designed, to recognize these foreign invaders and get rid of them. But you have some persons who are having this hypersensitivity that their immune system will even recognize substances that are not harmful, and they are going to mount a defense against them. And that is where you have the problems coming up when this reaction gets so severe and so hypersensitive that it's gonna affect the functioning of the body in a negative way. So the immune system becomes hypersensitive to one or more substances during abnormal reactions. An allergic reaction is a reaction by the body's immune system that occurs when a person has been previously exposed or sensitized to a substance or allergen. As we explained before, the body would have been exposed to an allergen, and the B cells would have recognized them as being potential likely to cause an allergic reaction. They would have copied them and caused the release of the IgE, immunoglobulin E, which are the antibodies, and they would go on to the mast cell and the basophils, and they are ready waiting for that allergen to reappear. And when it does, then it's gonna recognize it and release those chemical mediators. So the problem is when there are sustained releasing of those chemical mediators. To solve the issue, it can lead to systemic and widespread problems with those organs that we say are affected. So we don't want this reaction to be sustained. It should do its job and then it subside. But problems occur when the allergic reaction by the body's immune system, when they previously exposed or sensitized to a substance or allergen, and then it goes haywire. So the question is, when it moves from just a mild or moderate allergic reaction to the severe form of the reaction, which is anaphylaxis. So an allergic reaction, localized reaction, and also it can be systemic, but it is not as exaggerated as the anaphylaxis, which is the severe form. So the person is exposed, the body exposed to the allergen, it's gonna mount that defense, and it's gonna recognize it, and generally it will send out to that local area to contain it, and you will have that mild or moderate reaction, which will be localized to the area, or it can be systemic, but the reaction is not as severe, where it's gonna cause shutdown of your airway and the cardiovascular collapse. The problem occurs when it becomes very hypersensitive and very exaggerated reaction, and the person now having systemic edema. You have the cardiovascular system start to collapse, vasodilation generalize, and increased permeability of the blood vessel, and this cause leakage and drop in the blood pressure, and this affect also the heart, which is not contracting as forcefully as before. Cardiac output drop, also contribute to drop in blood pressure. You have hypoperfusion setting and reduced blood flow to the brain. Therefore, the person is affected in all the systems of the body. And that is the anaphylaxis. So you need to have an idea of what is going on when you're out in the field as an AEMT, but it's not to find exactly what is causing the issue, but is recognize that the issue is happening and potential complications that can arise. With the airway, you can have severe swelling of the airway. You can have the vocal cord, the epiglottic area being so swollen it can be completely occluded. You can have the lower ear passages being constricted to the point that it's hard to get the ear out, and the cardiovascular system collapses. This is a serious life-threatening condition. Fast action is needed. So as we continue to look at this is anaphylactic versus allergic reaction. You have a reaction that they call anaphylactoid reaction, and this is where normally we say that the T cells or the B cells would cause the release of the antibodies, which would latch onto the basophils and the mast cells and prepare to release those chemical mediators when the allergen reappear. That is how you get the anaphylactic reaction. But in anaphylactoid reaction, it is not generated by the IgE antibody, but there is other condition that is causing similar reaction as the anaphylaxis, wherein you would have the same vasodilation, you have the same vascular constriction of the bronchial passage, and the presentation will be similar to anaphylaxis. Again, it is not to try to identify which one is happening, but it's to recognize that what is happening and do what is necessary to stabilize that patient and recognize that ultimately you can only do so much as an AEMT in the field. So you must know at one point you need to take that patient to where they can get the definitive care that they need. So as we continue to look at the pathologic response, when there is an issue, so the mast cells recognize the invading substance and release chemical mediators. And these chemical mediators will be mainly in the form of histamine and leukotrienes. So the histamines are the first to be released, and they are going to cause blood vessels in the local area to dilate and the capillaries to leak. This is in order to send the cells that are going to actually destroy allergen into the area, and that is why it's happening that the cells, the blood vessel need to dilate and be more permeable to allow this to happen. But this is a good thing initially, but when it is sustained now, that is where it becomes a problem. So it is all happening for a good purpose, but sustainability of it will eventually start to become a negative thing. And also the leukotrienes, which are released at a later stage, they are even more powerful, and they are going to cause more vasodilation, more permeability, and the problem is going to continue. So it's all about trying to send more of the white blood cells in the form of the neutrophils that are really going to go and engulf those allergens. But again, we say if it is sustained, then it's going to cause the negative effect of it now, which is blood dropping the blood pressure, along with the effect on the heart, and this can lead to the collapse of the cardiovascular system, and also the sustained constriction of the bronchioles and the edema in the ear passages, swelling can have serious negative life-threatening implications. So the white blood cells help engulf and destroy the invading substance. So that's why it is important to have this initial vasodilation and increased permeability of the blood vessel, so that they can allow more of these white blood cells, which we say mainly will be the neutrophils, to go and destroy the invading substance. And also you have platelets begin to collect and clump together. So all this is an initial response to get rid of the invading substance. But if it's sustained and after it has done its job, the sensitivity continues, then that is what's going to lead to anaphylaxis. So anaphylaxis initial effect may be seen from release of histamines, with secondary effects following a few hours later, and the later release of the leukotrienes compound the effects of the histamine. So it's you'd call it a double whammy. So it's twofold: the initial from the histamine, and then the secondary release of the leukotrienes will compound the issue. It's a good thing initially to try to get those white blood cells, the neutrophils, to get in the ear and destroy those invaders. But if it's sustained, and then it will become negative effect of the initial positive effect. So clinical symptoms of anaphylaxis, how the person will present. And this is where, as AEMTs, your focus will be mainly where you need to recognize what's happening and take the necessary emergency care to deal with the situation. So skin symptoms are often the first indicators. So as I said, once the allergen appear, those basophils and mast cells will release those chemical mediators in the form of the histamine initially, which will cause the blood vessels to dilate and also the permeability to occur. So the cells that should fight the invading substance can come to the ear. So you're gonna have that initial response from the skin wear, because the blood vessels has actually lost their ability to constrict. So you have this pooling of the blood within those areas, and you will have the edema, the swelling. You will have we say that the nerves ending get depolarized, and they will have itching, the pruritus. So the indication will be locally there at the area of that is affected, and that's the first indication. As it continues, then you're gonna have angioedema, which is the swelling which accompanies it because of the fluid leakage into the extravascular space, and it may contribute to airway compromise. So all over is gonna be happening. So it's gonna be happening in the ear passage. So you'll have that swelling, especially the upper airway, the epiglottis, or the vocal cord region, and that can be, you have swelling of the tongue, and that can seriously compromise the airway. These are things as an AEMT you need to recognize. If it's not happening right away, potentially can happen. So you cannot let down your guard. You have to be able to recognize it and be prepared to act swiftly, because it's within minutes this can become or is a life-threatening situation. Because of the same edema, you can have swelling of the hands and feet. Respiratory symptoms are the most common complaint. That's what they're gonna be affected by. That's gonna be a chief complaint. And at a later stage, it can cause cardiovascular systems, which will affect the cardiovascular system. So symptoms are serious complications of anaphylaxis. That's where you have the collapse of the cardiovascular system because of the constant vasodilation, consistent vasodilation, and increased permeability cause a drop in the blood pressure. The heart is also affected by the histamine and also the leukotrienes, where its ability to contract is decreased. Cardiac output is affected, and also it will result in hypoperfusion, and it will play out in the symptoms and signs that the patient will experience. So you need to understand what's happening, what's possible to happen, and do what you have to do to help these patients. The blood volume moving from the intravascular space to the extravascular space can cause a shock. So that is what will give rise to our anaphylactic shock. You will also have gastrointestinal symptoms may occur because the histamine also causes the reduction in it causes the smooth muscles to be affected also. And because of that, it will affect the movement of the stool in the the gastrointestinal system. And so the patient will have nausea, vomiting, cramping. All those are as a result of the effect of the histamine on the different systems of the body. Central nervous system symptoms, because of the hypoperfusion, the patient become hypoxic, reduce oxygen to the brain, and glucose will cause headache, dizziness, confusion, anxiety, and they can move from different levels of consciousness, mental status. They can become even unresponsive, move into coma. The patient might tell you that they feel like they are going to die, sense of impending doom. Don't take it lightly. It's definitely saying that they are being affected. They're not getting oxygen to the brain. They're going to feel that way, that they are going to die. So this should be an indication to you that this is reaching serious state. Once you have recognized that the patient is experiencing this situation, then you need to act quickly. And we say that your anatomy of the immune system, your understanding of the physiology of the immune system, how it works, then you will understand that these are the problems that can occur. How will you manage these patients when you are called to these emergencies? Someone having a difficulty breathing might be the call, as we said, that these respiratory symptoms is the main concern. So you might receive a call of that nature. How will you respond and assess that patient? So patient assessment will always be patient assessment. It's always those 5 main steps you have to go through. It doesn't change. You might have to modify it based on each individual situation, but it's always the same. Patient assessment is the same generally. So you have to start with your scene size up. But for immunologic emergencies, recognizing that it's time that your seconds count. It's the matter between life and death of that patient is in your hand to do what you need to do initially to stabilize them. Because as we said, the airway can become completely obstructed. The cardiovascular system can collapse within minutes. So recognize that. So problem identification and intervention within seconds is crucial. Response to antigens may occur in a multi-step manner. As we said, it's a progression. Reactions can be acute or delayed. The histamine, we say, will cause that initial. The leukotrienes will be more delayed. In prolonged, persistent reaction, anaphylaxis symptoms continue over time from 5 to 72 hours. We also have where the patient can be having a biphasic response, where they will recover from it and then symptoms will reoccur without another exposure to the allergen. So you have to recognize that. And also we said the leukotrienes are released at a later stage, so it's a compounding effect where the reaction can be sustained. But in all patient assessments, you will start with your scene size up. And with scene size up, the first thing we look at is the ensure that the scene is safe. We are dealing with immunologic emergencies, so If we talk about the 5 categories of how the allergen can enter the body: sting and insect bite, insect sting and bite. So if they're in an environment where they were exposed to wasp and bee, this is an area that might not be safe for you. So you have to ensure that in that case the patient is brought to you. But at the end of the day, safety will always be the concern on all calls, and even more so with immunologic emergencies. So patient environment or recent activity may indicate the source of the reaction. So for medication, a patient might have taken a new medication, and so it is that what is causing their allergic reaction. So check your surrounding and ensure that the scene is safe before you move into any scene. Never enter a scene where more than one person is experiencing the same symptoms with a similar onset. This is suggesting to you that something is in the environment that is causing it, and if you go in there, then you will only also be likely to succumb to it. Determine the mechanism of injury or nature of illness. So once you have ensured a scene is safe, again, it is down to mechanism of injury, nature of illness. With an immunologic emergency, the person could have sustained trauma before or after. So don't be tunnel vision. Always have an open mind and do your assessment and follow as it leads you. Do not let your guard down. The scene might be safe initially. It can become unsafe during your management. So be aware of your surrounding at all times. Once you would have completed your scene size up, which would be ensure that scene is safe, you would have looked at your MOI and NOI, and if trauma is involved, you must suspect that you have to take spinal motion restriction precautions. You would have taken your standard precaution. Minimum in these cases, you have your gloves and your mask. If you need to go further, you put on your full gear. Also, you need to ensure that you have an idea how many patients you are dealing with. And last thing you must do in the scene size up is to ensure that you would have called for your additional resources. You're an AEMT. You must think that's especially this case that we're talking about with these allergic reaction. It can be severe where you cannot manage the full extent. You can only do so much and no more. You need to call for paramedic backup. Again, it's all about your jurisdiction, whether that's available, but that's something you need to consider. Once you have completed your scene size up, then it's down to your primary survey or primary assessment. Again, it is the same general impression first. Look at your patient, get an idea if the patient appears stable or unstable, and that will guide you as you progress into your assessment. You must determine the LOC of the patient, level of consciousness, and again, if you're suspecting trauma, with your spinal motion restriction, manual stabilization, if indicated. Once you have completed that, then it's down to your A, B, C, D, E. And if we have possibility of bleeding, exsanguinating bleeding, then it's gonna be X, A, B, C, D, E. Doesn't change, just modify based on your patient condition. So the severity of the problem will be indicated by the patient's presentation. And that is why we say you can start judge it from the general impression. Respiratory symptoms should be swiftly assessed. So once you are in primary survey, it's about finding those live threats, both immediate and potential, and dealing with them accordingly. You cannot find one and then skip it and go to the next. And it's gonna be ABC first. Deal with airway, then you go to breathing, unless we say that there's an exsanguinating bleeding. Position of the patient is important. So a patient who is alert, having these patients having anaphylactic reaction will be better in the forward tripod position, leaning forward. So it's better to have them sitting up. For unresponsive patients, assist ventilation using a bag mask device, and this patient would be in the supine position. So begin life support measures if a patient is unresponsive or pulseless. So once you are dealing with your ABCs, you are going to manage accordingly. Patient's airway need to be addressed first, as we said, and if you need to suction, you suction. If you suspect trauma, then you turn the patient as a unit. You need to ensure that the patient is unresponsive. The possibility is there for them to airway being blocked by the tongue. So do your airway maneuver. Once you have ensure that airway is clear, then it's always going to be down to your breathing. If the patient is not breathing and don't have a pulse, then you will start your CPR. But as an advanced person, you need to be able to deal with your breathing and manage the breathing accordingly. You need to ensure that you connect your cardiac monitor. You need to get your end-tidal CO2 reading. That's very important, especially in these patient population. You normally, we know that the end-tidal CO2 normal range is 35 to 45 millimeters of mercury. When the person is having these severe case of breathing issues, it can be low. So you need to expect that management of these patients is very important. If you need to give supplemental oxygen, you give it, or if you need to ventilate the patient, you ventilate them. But it's important that you address it. Some of these patients will benefit from the CPAP to force the air into the alveoli. So treatment for shock, if we suspect that the patient is having showing signs of shock, will always be administering oxygen, even if they are not showing a respiratory issue. But once you are seeing signs of shock, which would be low blood pressure, cool, clammy skin, then it's indicated that you administer oxygen. Again, we are going to maintain the 94% to 99%. You titrate accordingly and place the patient in the supine position, and also prevent loss of body fluid, cover the patient to keep them warm. You're going to continue the assessment at scene if the patient is calm and does not exhibit any symptoms. So you need to make a decision. Once you have completed your A, B, C, D, E, you must reach the point that you would have gotten your patient's GCS and you would have decided if this is a load and go, or you can stay and continue with the rest of the assessment unseen. But in most cases, once they have reached that point where they're having a severe allergic reaction, then you need to be doing what you have to do and get that patient off scene. So you need to check their circulation. If there's trauma and sign of bleeding, you'd have controlled any bleeding. You'd have checked pulse rate, strength, rhythm. Again, we say these patients can have problems with their cardiovascular system. They can have dysrhythmias. So it's important that you have your cardiac monitor attached and getting that rhythm reading. Also, if the person is moving to the decision as to load and go or stay and play, then you need to make that decision quickly. Once you have completed your primary survey or assessment, then it's down to history taking. And again, it's dependent on the patient condition. You need to get the history of your conscious patient as quick as possible. And it's going to be the chief complaint first, followed by the rest of the sample history. And you need to ask the pertinent questions relating to what's happening to them immediately. Especially, is this the first time this is happening? If not, then how did it affect them before? How is it managed? These are important questions that will guide you. But you're always gonna use your OPQRST to guide you in getting as much information as possible, and you will identify associated signs and symptoms. If the patient is responsive, begin by obtaining the sample history. If the patient is unresponsive, don't say you cannot get any history. Again, these patients who have allergic reactions, they will have their bracelet which identify them as being allergic to whatever substance if it's a known sensitivity. Also, they might have a card in their wallet. You can check and get whatever information you can get from family member, bystanders, but it is important that you get history, which will help you in your assessment. After you have gotten your history, and again, it's dependent on your resources you have on hand. If you're a team leader, then you can assign your partner to be getting some vital signs while you are getting the history. But at the end of the day, you need to get your history, and then you need to perform your secondary assessment. So in the secondary assessment, you're going to be focusing on the area of concern. If it's a localized issue, if it's a systemic, then you want to be searching the body, which would have done a rapid scan from your primary survey or assessment. You would have decided if you need to do a rapid scan. You might say it's a medical case, but you still need to search the body for same things that we see coming up in allergic reaction, the rashes, the hives, signs of swelling. When you search the body, you would have determined them if the patient cannot tells you exactly what's happening to them. So it's important that you would have done that rapid scan, whether it's a trauma or not non-trauma. If it's indicated for rapid scan, you should do it early to pick up exactly what's happening with your patient. But in your secondary assessment, if you have no need to do a full body scan or examination, then you at least have to do your focus examination, the area of concern. And we say with these immunologic emergencies, the system that are affected, the respiratory, the cardiovascular, the nervous system, the skin. So we need to assess those areas at a minimum. You also need to do your vital signs, and you're going to use your monitoring devices. So again, if you had not put on your cardiac monitor before, you need to have your cardiac monitor attached. You need to have your pulse oximetry reading. You need to have your end-tidal CO2 capnography reading. All these monitors will help you to see what's happening to the patient. Also, you need to get your full range of vital signs, respiratory rate, depth, rhythm, quality, your pulse rate, strength, quality, your skin condition, color, temperature, moisture, your capillary fill, your GMR if it's indicated. So your whole range of vital signs must be done in your secondary assessment. And I said, it's all about your resources on hand. You can be multitasking, you can be doing them simultaneously, but at the end of the day, you need to get it done. Once you have completed your scene size up, your primary survey, our primary assessment, you have completed your history taking, and you have completed your secondary assessment, then it is down to your reassessment. These patients need to be reassessed very carefully. As we said, these conditions can change rapidly. And so once you recognize that your patient is high priority, significant severe anaphylaxis or allergic reaction, then this patient must be reassessed every 5 minutes. If they are stable, must do a reassessment every 15 minutes. So these reassessment must be conducted en route through the receiving facility. So you have managed your patient to that point where you are at the reassessment stage. You have to do that as you are traveling along with your patient. So it's all about doing over what you have done for your patient before. So you're going to go back to your primary assessment. You're going to go back to your LOC check. You're going to go back to your ABCs. You're going to reassess the chief complaint. You're going to do back over your vital signs. You're going to look back at your interventions, whatever you had done for the patient before, check to see if it's working. If anything needs to be adjust, or if you find any new problems, you have to deal with them. So it's very important that you do this reassessment. As we said, the patient condition can change rapidly. They can deteriorate rapidly. You have to be reassessing to catch those situations before they worsen. So special attention should be given to any signs of airway compromise. The patient say that they feel like they have a lump in their throat, think that their airway is becoming swollen. Interventions, check the effect of epinephrine administration, check if the patient's condition has improved or if a second dose is required, recheck interventions. So the golden treatment for the person in the anaphylaxis will be the epinephrine, which will reverse all those things that we say is happening from the histamine and the leukotriene release. And epinephrine will release it. So it will cause the bronchioles that are constricted, it will cause them to dilate. It will cause the blood vessels that are dilated, it will cause them to constrict, and it will act upon the heart to increase the contractility of the heart. So it's gonna reverse all the effect of the histamine, which we say was good at first, but if it's sustained, it's gonna have a negative effect. So you need to ensure that if the person condition not improving, then you might have to go back to even another dose of the epinephrine, but you will always be following your protocols. And as I said before, recheck interventions. And a crucial part of your reassessment also is that you must communicate. So once you have gotten all information on your patient, then you should be calling into the receiving facility, notifying them what you are coming in with. So it's very important. We say time is important. So they can be prepared for you. So when you reach, they are ready for that patient to do what is necessary. So you have to relay that information. If you had done any get any reading with your from the cardiac monitor, you can send that in also. And it's very important that you start your documentation. And other persons cannot write while they are traveling in the ambulance. So if that's the case, but you can jot down things roughly on your notepad and make sure you have this information. It's very crucial that you have detailed documentation. They say if it wasn't written, it wasn't done. And if it's not written properly, then they will say CMWA did not give a proper treatment. So communication and documentation, when to contact medical control depends on your assessment finding. But as soon as you have gotten the bulk of your information, then you need to call in. And some things you can call in as you realize it. You can inform them what's the situation. Earlier activation and notification is better. Documentation should include detailed signs and symptoms and reason for specific care. And in some allergic reactions, you may use standing order to administer epinephrine. As I said, that's the golden treatment in these cases. Ensure to record patient's response to the treatment. Very important. So once you administer a treatment, you need to record the response. And if you need to follow up, then you follow up. And that would be your patient assessment. As I said, it's the general thing for all patients, but you just tweak it to suit the immunologic cases that you'll be called to. But it's always going to be the same general principles for patient assessment. And also recognize that some patient will benefit if you have the facility for air transport. So once you make your decision for moving the patient, then from your scene size up, even your scene size up, you can recognize that the need might be there for a transport. You can call for it from even at that stage, because the sooner you call, the sooner they will arrive. It's better to call and you don't need them. You can turn them back rather than waiting too late, and then it's gonna make not being good for your patient. So we look at the general patient assessment of patient having immunologic emergencies. Now we are going to look at the specific emergency medical care for the different types of pathologic reactions. But we are saying that as healthcare providers in the pre-hospital settings, the main case will be called for of all the different range of immune system disorder. It's gonna be for the anaphylaxis, severe allergic reaction. So essential to differentiate between anaphylaxis and other conditions. It's essential, but it's not our primary concern. Remember, as healthcare providers in the pre-hospital setting, our job is not to diagnose. We're trying to establish a field impression. We have to have an idea of what we are working with out of all the differentials, but it's not to try to diagnose. That's not our job. As I said, you're focusing on what they are presented with, treat what they are presented with, stabilize the patient, package them appropriately, and transport them to where they can get the real definitive care. There's so much you can do. No matter what your level, you're an advanced, there's so much you can do in your scope of practice. People with allergic reactions are separated into two groups for treatment purposes. So the first group includes patients who have signs of an allergic reaction but no signs of anaphylaxis. So we say it can be a localized reaction, and it can affect the system, but it is not reaching to the point where airway is being compromised and cardiovascular system collapsing. So that's the first group of people. But the second group includes patients with signs of anaphylaxis. So this is severe allergic reaction where they require 100% oxygen. You might be ventilating them. They need the golden treatment, we say, which is epinephrine, which is going to correct all of those signs, which is coming from the release of the histamine and the later release of the leukotrienes, and also antihistamines. So this is the second group where we have to act quickly, and most of the time this is where we'll be called when it's getting to this stage or has gotten to this stage. So again, your emergency care will be the general format, which we described earlier, but it's gonna zone in specifically for this case where the person is having an anaphylactic reaction. So early administration of epinephrine should be a priority, and the IM route is a better route, quicker route, and so you're gonna use the IM route if the patient shows evidence of airway or respiratory compromise or hypotension. Again, we say the epinephrine is gonna reverse those conditions that are caused by the histamine. So the epinephrine will cause the blood vessels to constrict, which they were dilated before from the histamine release. It will cause the bronchioles that were constricted to dilate, and it will also act upon the heart to cause the increased contractility. So that's the complete reversal of what is happening from the histamine, which you say was a good thing originally to send those white blood cells into the area to engulf and destroy the invading allergen or organism or bacteria. But if it's sustained now, it's gonna lead to this hypersensitivity, which can be a bad thing. So administration in the thigh is preferred over the deltoid site for more rapid absorption. So for the epinephrine, you're gonna give it the IM route. It's better to go the lateral aspect of the thigh, mid-thigh, rather than the deltoid, because it's gonna give for a faster absorption, which the patient really need in this case. So epinephrine can rapidly reverse the histamine release related effects of anaphylaxis. So that's the goal and treatment for us in the pre-hospital settings. And the patient, most of the time, if they have this known sensitivity, they will have their EpiPen or they will have their meter dose inhaler. But as an advanced EMT, if they don't have it, then your protocol should cover you to administer the epinephrine. So you should be able to draw up the dosage, and it's gonna be 0.3 milligram of the 1000 epinephrine, and it's gonna be, as it says, IM is a better route, lateral aspect of the thigh, and so you will have to follow your protocol. You should have your standing order, or you will have to call to get online permission. As again, any medication have to have the standing order or online permission, and you also have to ensure that you check the rights of the medication. So in your emergency care of this patient with anaphylaxis, you will always follow your ABCs. Ensure the airway is patent. If you need to suction, you suction. You need to ensure that the patient ventilation is adequate, and suspect oxygenation problem, then you give supplemental oxygen, and we say that you ensure that you're at your rate 94 to 98%. You don't want to over oxygenate, so you titrate it. So the side effects of epinephrine, it's gonna have a great effect, which are positive effect, but also it can have these side effects. Again, if the life-threatening situation is, if the situation is life-threatening, then we are gonna lean on the side of giving it even if these side effects can happen. So what are some of the side effects? The person can become tachycardic, so they're gonna increase their heart rate. They can become anxious. They can become pale. They can become dizzy. They can have chest pain, headache, nausea, vomiting. These are side effects of the administration of the epinephrine, because, like we say, it's gonna increase their contractility of the heart, increase heart rate. It's a symptomatic, so it's gonna cause those action on the heart, and it gives rise to some of these signs and side effects. But as we say, when a person is having severe allergic reaction, they're having anaphylaxis, it's gonna be a worse situation where the airway is gonna be can be completely occluded. They can have complete collapse of the cardiovascular system. So it's got trade-off you have to make in terms of giving that epinephrine, even at the risk of having these side effects. These side effects gonna be less important. But again, you're gonna follow your protocols. Assessment and management of insect stings. So we say that the 5 categories of how allergens can enter the body is by insect stings and bite, by food, medication, certain plants, and chemicals. So once a person has been exposed to insect sting in the form of, it can be bee, wasp, and with the wasp, we know that they can sting and re-sting because it's a barb that come from their abdomen that administer the venom, and it can sting and re-sting. Not barb, the spike, the spine. With the bee, their spine is barbed, so it's like a hook. So once the bee sting you, then that hook or spine is left in you, and a part of the abdomen gonna come off. So eventually that bee will die. That's not the case with the wasp. The wasp can sting and re-sting because their spine is not barbed. And that's another thing. When you go on the scene, you should be careful that that scene can have more wasp there, or the same wasp can come back and sting you. So that's a consideration in your scene safety. But insect sting allergy accounts for approximately 90 to 100 deaths each year in the United States. So this is you can say it's a situation that merits consideration. The stinging organ of most bees, wasps, and hornets is a small hollow spine projecting from the abdomen, as I said. So how do you assess and manage these patients? Some ants, especially the fire ants, strike repeatedly, injecting a particular irritating toxin or poison at the bite site. So most of the time, these will just be a localized issue, and the patient will have this rash, itching, swelling at the area, but it doesn't progress to the point that it's become systemic, and it will not necessarily give rise to anaphylaxis. But for some persons, as we said, they can have this hypersensitivity, and it can progress. So that's something to consider. So it's always going to be what is presented, you treat them accordingly. So if they are presented with these signs of anaphylaxis, then you will have to do what you have to do. But signs and symptoms of insect stings and bite include sudden pain, swelling, localized heat, widespread urticaria, and redness. So you'll have these hives, these swelling that occurs, and we say it's because of the initial response where the histamine release and also it's from the venom that the insect would have injected will cause these symptoms and signs. Maybe itching and a wheal. So apply ice sometimes make wheals less irritating, and you're going to attempt to remove the stinger by scraping the skin with the edge of a sharp, stiff object. So as we said, if the stinger is in place, then it is suggesting that it's from a bee more than likely, and it would have a part of the abdomen attached, which would have the potential to continue to envenomate the patient. So the release of the venom or the toxic substance will continue, and you have to be careful how you remove it. If you try to use a tweezer and pull it out, you can effect be causing more toxin to go into the person. So the idea is to use a sharp stiff object to scrape it off, which is will actually remove it without injecting more toxin into the body. So always be mindful of airway swelling and other anaphylactic signs and symptoms. So it can progress just the same into severe allergic reaction, where it can cause occlusion of the airway, it can cause collapse of the cardiovascular system. So place the patient in the supine position if indicated, and these are the patients who we say unresponsive patients showing signs of shock, or if the patient is conscious, no signs of shock, then they're better in a sitting position. And again, manage your ABCs. If they need ventilator support, then you have to provide it. If they need oxygenation by supplemental oxygen, again, we say titrate it to your 94 to 98 or 99%. You need to connect your cardiac monitor, get your entitled CO2 capnography reading, and monitor the patient's vital signs and be prepared to provide additional support as needed. So it's very important that you do what you have to do for the patient based on how they are presented. So it's a sting or a bite. Again, we say it can be mild, but it can progress to same full-blown anaphylaxis and be a severe allergic reaction. So you have to be prepared to do all that is necessary. And with every emergencies, if it can be prevented, that would be the best way to go. So we are healthcare providers. You are an advanced EMT, and you'll be going out there to respond to these calls. But if we can have these persons preventing these situations, then it will be better for us. Again, I say might not be what the private ambulance company would want, but on a whole, we should be advocates for our patient. So prevention should be our route. So we should always be educating our patient. And when we're looking at immunologic emergencies, how can we educate our patients? If we can tell them about ways of avoiding the antigen, that's the best way to prevent this immunologic emergency. If they can avoid the antigen, and we talk about the allergens group, that you're allergic to certain things, then you have to avoid them at all costs. Sometimes it's not easy to avoid them because some of them, a person might be allergic to peanut, and they might be eating something, it doesn't state that peanut is in there, but it's in a different form, and they might not realize it. So next thing is to notify all health personnel of the allergy. Again, we say a person might be unresponsive when they reach unseen. If they have their bracelets or they have their identification cards, then we can see it and we can recognize that they are allergic to these things and have an idea of what's happening to them. So it's important that we educate them about these things. And also, if they are known sensitive to an substance, then they should have their EpiPen and anaphylaxis kit. And most case episode, they might need more than one dose, so they should also have their kit that has more than one EpiPen or double doses. Report symptoms early. So again, we say this condition can progress rapidly. So they might just be having a mild case and don't take it serious, but it's better to report it early because these symptoms can progress rapidly. And before you know it, they're at a life-threatening stage. And this brings us to the end of this chapter and on immunologic emergencies. Any questions? I noticed Mr. Bradshaw is still having signal problems. Any questions?